मुक्त जीवन की सही शुरुआत है ऑटिज्म की सही जानकारी।
Trusted by parents worldwide. Call now Dr. Navdeep Sharma, world's senior autism expert. 7791 006 006.
ऑटिज्म मुक्त जीवन की सही शुरुआत है ऑटिज्म की सही जानकारी।
By parents worldwide. Call now Dr. Navdeep Sharma, world's senior autism expert. 7791 006 006.
ऑटिज्म मुक्त जीवन की सही शुरुआत है ऑटिज्म की सही जानकारी।
Trusted by parents worldwide. Call now Dr. Navdeep Sharma, world's senior autism expert. 7791 006 00.
ऑटिज्म मुक्त जीवन की सही शुरुआत है ऑटिज्म की।
Namaskar, a very warm welcome in today's special live and a very happy World Autism Awareness Day to you all. So आज हम आपके साथ ऑटिज्म के ऊपर बात करेंगे और ऑटिज्म जिसकी जब हम बात करते हैं जो एक ऐसा डिजीज है, मैं चाहूंगा राघव आप दूसरे व्यू पे स्विच करिए क्योंकि मेरे को ऑडियंस को साथ के साथ कुछ स्लाइड्स भी दिखानी है आज, क्योंकि आज हमारा जो लाइव है it is a special live which is there for the special judgment given by our Honorable Supreme Court. Yeah, the judgment was given in January, but I thought it is very important for me to be discussing the judgment with you on this World Autism Day. अब जब हम ऑटिज्म की बात करते हैं, अक्सर जब पेरेंट्स मेरे पास आते हैं, the parents are having a common question, and the question is कि do we need to go for a stem cell therapy in our child? Is a stem cell therapy good for my child? So समझते हैं सबसे पहले क्या है ये स्टेम सेल थेरेपी, कहां करवानी है और कहां नहीं करवानी है. So please zoom it up to the slides over here. So coming to a stem cell therapy, you can zoom it nearby. I want the audience to once look at it, and if you're having a slide which you can for once show on the live stream, Raghav, I would really appreciate. You can share it over there. So you can see over here the stem cell therapy slide. So when we talk about the cells in our body, there are various kinds of cells. You can now remove the slide. So there are various kinds of cells in our body, and as our body differentiates, jaise now you can switch on to the next view, Raghav. So once we talk about our body, jaise हमारी जो बॉडी है डिफरेंशिएट करती है, एज आर बॉडी डिफरेंशिएट्स, हमारे जो सेल्स हैं हायर ह्यूमन बींग्स के अंदर वो स्पेशलाइज्ड हो जाते हैं. इफ यू टॉक अबाउट अमीबा, इफ यू टॉक अबाउट पैरामीशियम, इफ यू टॉक अबाउट सिंगल सेलुलर ऑर्गेनिजम्स, या हम सिंपल ऑर्गेनिजम्स की बात करें तो वहां पे एक ही सेल सारे काम कर रहा है. वही सेल न्यूट्रिशन कर रहा है, वही सेल आगे एनर्जी जो है वो बना रहा है, वही सेल एक्सक्रीशन कर रहा है. लेकिन जैसे जैसे हम हायरार्की में ग्रो करते हैं, स्पेशलाइज्ड सेल्स जो हैं वो बॉडी में आ जाते हैं, और उन स्पेशलाइज्ड सेल्स में से कोई सेल बन गया आई का सेल, देखने के काम आ रहा है. कोई सेल बन गया डाइजेस्टिव सिस्टम का सेल, डाइजेशन करने के काम आ रहा है. सो इस तरह से द सेल्स दे बिकम सुपर स्पेशलाइज्ड. अब उसका क्या नतीजा होता है कि सुपोजिंगली देयर इज अ नर्व सेल इन आवर ब्रेन. नर्व सेल का काम करेगा, बॉडी का कोई दूसरा सेल नर्व सेल का काम नहीं कर पाएगा. और यही कारण है कि इफ यू टॉक अबाउट द स्ट्रक्चर ऑफ आवर ब्रेन, इफ यू कैन शेयर द ब्रेन स्ट्रक्चर ओवर हियर टीम, हम बात अगर करते हैं ब्रेन के हमारे स्ट्रक्चर की. सो व्हेन वी टॉक अबाउट आवर ब्रेन, हमारे ब्रेन के अंदर जो अलग अलग तरह, स्क्रीन पे आप देख पा रहे हैं ब्रेन. सो जो हमारा ब्रेन का स्ट्रक्चर है, इसके अंदर ब्रेन में हमारे सेरिब्रम है, cerebellum है, there are various parts of the brain, and each part, you can remove it now, each part of the brain is having a specific function to do. Cerebrum is doing different functions, cerebellum is doing different functions, so brain का हर part separate function कर रहा है. Now, when the parents they come to me for autism, at least in 90% of those children, what I see is that the structure of brain is perfectly all right. There is absolutely no problem in the structure of the brain. But despite that, the irony of the thing is कि इस brain में कोई भी structural problem है ही नहीं, जहां की हमें stem cell से repair work करवाना है. उसके बावजूद बिना एमआरआई करवाए हुए भी एक ऑटिस्टिक बच्चे को यह बोल दिया जाता है कि आप स्टेम सेल थेरेपी करवाएं, इससे आपको लाभ मिलेगा। Again, coming back to the topic of stem cells, if you can share the next slide of stem cells. So, जब हम बात करते हैं stem cells की, तो it becomes very important for us to realize over here that stem cells की बात कर रहे हैं तो they are used in blood disorders, some kind of cancer, certain immune cells, then they are used for Parkinson's disease, spinal cord injuries. इनमें से कुछ चीजें ऐसी हैं जहां stem cell के ऊपर जो वर्क अभी चल रहा है, it is in the experimental mode. It has not yet been established. लेकिन स्टेम सेल्स हैं क्या? स्टेम सेल्स हमारी बॉडी के वो सेल्स हैं जो डिफरेंशिएट नहीं हुए, ऐसे सेल्स जो अक्सर आजकल स्टेम सेल बैंक्स में रख लिए जाते हैं एट द टाइम ऑफ बर्थ। इसमें प्लेसेंटा के सेल्स हो सकते हैं, कई तरह के सेल्स हो सकते हैं। व्हेन वी प्रिजर्व दो सेल्स, ना दो सेल्स, क्योंकि वो डिफरेंशिएटेड सेल्स नहीं हैं, वो सेल्स किसी भी ऑर्गन में जाके लाभ कर सकते हैं। सो जहां कहीं ऑर्गन डैमेज हो, वहां इफ वी यूज स्टेम सेल्स, दो स्टेम सेल्स कैन गिव अस बेनिफिट। बट यहां हमें समझना जरूरी है कि ऑर्गन डैमेज तो हुआ हो। अगर ऑर्गन डैमेज ही नहीं हुआ, जैसा कि हम अक्सर देखते हैं इन autistic case where the brain is perfectly all right, you can switch on to the next mode, making it easier for the audience to go. Yeah. So, जहां हम ये देख लेते हैं कि अभी जो एग्जैक्ट हमारा ब्रेन है, उसमें ब्रेन का एमआरआई इज जस्ट लाइक एनी अदर नॉर्मल चाइल्ड. सो वी डोंट हैव एनी काइंड ऑफ प्रॉब्लम ओवर देयर इन द ब्रेन. सो जब ब्रेन में कोई प्रॉब्लम है ही नहीं है, सो क्या हमें उस समय वाकई में ही स्टेम सेल्स की जरूरत है? क्या करेंगे स्टेम सेल्स वहां जाकर के? क्योंकि स्टेम सेल्स को तो जाकर के रिपेयर वर्क करना था, और यहां हमारे पास रिपेयर करने को कुछ है ही नहीं. सो समझिए, स्टेम सेल केवल वहीं चाहिए जहां ब्रेन में डैमेज है. और क्योंकि हमारे माननीय सुप्रीम कोर्ट में उन्होंने पाया कि अननेसेसरी बहुत से बच्चों के केसेस में स्टेम सेल थेरेपी की जा रही है, एक्सपेंसिव है, merely for minting out money, unnecessary की जा रही है. That is why it was banned in autistic kids. So when you ask the question next time from me, this is what I feel gives you answer, that stem cell is only required where there is a damage in the brain. So brain में damage है तो समझ लगती है कि स्टेम सेल थेरेपी के बारे में आप सोच सकते हैं. ब्रेन में डैमेज ही नहीं है तो स्टेम सेल थेरेपी हमें बिल्कुल नहीं करानी है. सो हमारे साथ बने रहिए. एक छोटा सा ब्रेक हम लेंगे यहां पर, और ब्रेक के बाद आपके क्वेश्चंस की तरफ हम प्रोसीड करेंगे. आप लोग तब तक अपने जो क्वेश्चंस हैं उन क्वेश्चंस को फॉरवर्ड करते रह सकते हैं. रुकते हैं एक छोटे से ब्रेक के लिए. बिल्कुल छोटा सा ब्रेक है, बने रहिएगा जी.
According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth.
Ayurvedic treatment rests on three powerful pillars: Daiva Vyapashraya, Yukti Vyapashraya, and Sattva Vajaya. I try to combine all three of these approaches for the treatment of children suffering from autism. Sattva Vajaya Chikitsa is a form of treatment that includes modern day psychotherapy within it. Being a D.Litt scholar with PhD in role of Ayurvedic herbs in psychological disorders, as well as a dedicated researcher, it has been comparatively easier for me to apply Ayurvedic Sattva Vajaya Chikitsa in integration with Yukti Vyapashraya Chikitsa with greater precision and effectiveness. This combined approach has been consistently used by us in the management of children suffering from autism. In addition, selected aspects of Deva Vyapashraya Chikitsa have also been incorporated wherever appropriate. I would now like to present one case study to begin with. This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding. Parth's detailed medical history was documented and evaluated before initiating treatment. In July 2023, Parth's parents consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. Following the comprehensive assessment, Parth was recommended the medicine's prescription Braino R dose, 10 ml in afternoon, 20 ml at night. Braino R contains these Ayurvedic herbs: Mandukparni, Kushmand, Ashwagandha, Amlaki, Jatamansi, Sarpagandha, and Ustupurus. Braino A dose, 30 ml in the morning. Braino A contains these Ayurvedic herbs: Shankpushpi, Brahmi, Shatavari, Ringraj, Shunti, and Vacha. Pumpkin seeds oil dose 8 drops in the morning, 8 drops in the evening. Contains Ayurvedic herb ingredient pumpkin seeds. Mukta Pishti dose 125 milligrams in the morning, empty stomach. Contains marine pearls.
At the initial assessments, Parth's hyperactivity was 3 out of 5. There was reduction in hyperactivity before second consultation with rating at 2 out of 5.
कलर करो, वेरी गुड पार्थ, कलर करो। नो, इस हैंड से करते हैं, इस हैंड से, राइट हैंड, वेरी गुड, चलो कलर करो।
At the start of treatment, Parth's speech was rated 1 out of 5. There was improvement before the second consultation, with the rating rising to 2 out of 5.
बस बस
हो गया अबे
Initially, command following was deficient with a rating of 1 out of 5. Prior to the second consultation, improvement was noted with a rating of 4 out of 5.
वेरी गुड, खाओ, वेरी गुड।
Initially, eye contact was rated 3 out of 5. Before the second consultation, his eye contact improved to a rating of 5 out of 5.
उसका वीडियो बनाओ तो वो लड़का और भड़कता है एकदम से।
पार्थ, खाना खा रहे हो? खाना खा रहे हो? हाँ?
पार्थ, आपको क्या खाना है?
क्या खाना है?
At the beginning of treatment, Parth exhibited verbal stimming, visual sensory concerns, and hand flapping with a rate.
So welcome back, and we are going ahead with your questions now. And the first question which I can see over here is from Manpreet Kaur ji. You have mentioned that my child now 6 years complete. Now he speaks sentences, eye contact, good treatment going on now. Need work on academics. So Manpreet ji, it's really nice to know that your child has improved with the treatment being provided over here. And when we need to work on the academics along with the rest of the medicines that you are taking, you can also start with Saraswata Rishtam with Gold. Now, Saraswata Rishtam with Gold is a medication which we specifically use for academics. So, along with the rest of the medicines which we are giving you, you can start with Saraswata Rishtam with Gold. Going further ahead, the next question is from Peaceful Progress. And Ashima is the coordinator, and Harjot ji is the patient. And it is now the hyperactive phase, and he's holding his urine too, didn't sleep whole night, hyperdose taking. In any case, please do remember the sessions must go on regularly. I hope he's now comfortable with Ishan. He's taking those sessions with Minu, and Brainowar mild immediately to be stopped. It will be Brainowar DS, where we need to move on over here. And Jeta Mansuel, Sarpaganda Vati, that all is carrying on, that needs to be carried on. Along with that, it has been updated that he is very hyperactive since yesterday, too much body rocking, being vocal, running here and there a lot. He's agitated too. And I always guide you that whenever you see something, try changing his environment at that time. The last time when we discussed, unluckily you took him to somewhere which I don't want to. We want him to be going to some place which is more spiritual in nature or which is soothing in nature to change the tempo of his mind currently. So trying doing that, and let me know about that. Going further ahead, Mr. John Wick. Sir, our son has progressed a lot, but these days showing regression. He is hyper and aggressive. If we ask him to do any activity, he gets agitated. His ear turns red and he shouts a lot. Does not let us touch the body. And you are from UK. And another thing which I would like to update over is that with the temperatures changing, whenever there is a change in temperature from winters to summer or from summers to winters, like now we are having it from summers to winters to summers. So there will be some agitations in the children. You can increase the dosage of Mukta Pishti for the time being. Mukta Pishti ko thoda increase kariye. You can also take sandalwood oil for a few days. That should be supportive enough. So that is something which needs to be taken care of. Priya Salaria ji, हर जगह से अलग अलग एडवाइस मिल रहा है. डॉक्टर नवदीप शर्मा जी की ट्रीटमेंट ने क्लियर डायरेक्शन दिया. Thanks a lot, Priya ji. See, the most important thing which we always need to be knowing is that सही डायग्नोसिस, ऑटिज्म को सही से समझना और उसके बाद सही एक्शन लेना बहुत जरूरी है. क्योंकि देखिए, अगर हम नहीं लेते हैं ऑटिज्म के अंदर सही किस्म का डिसीजन, तो सही डिसीजन ना लेने से क्या हो जाएगा, हम कितने ही समय के लिए चलते चले जाएंगे ऐसे सेंटर्स पे जो हमारे घरों के पास हैं। अक्सर जब मेरी बात होती है, जब मैं पेरेंट्स से मिलता हूं, द पेरेंट्स टेल मी दैट सी, either if they are taking treatment from NHS, they will say that we are taking it with NHS and it is comfortable for us. It is absolutely free of cost for us. It is just next to a place. और अगर इंडिया में हैं या कहीं और जगह पे हैं तो वो कहेंगे जी बिल्कुल साइकोथेरेपी सेंटर हमारे साथ में है, हमारा बच्चा हम 4 घंटे के लिए वहाँ छोड़ के आ जाते हैं, 5 घंटे के लिए हम वहाँ छोड़ के आते हैं, वो लोग हमारे बच्चे पे वर्क करते हैं। प्लीज आप याद रखिए, आपके बच्चे को अगर कोई ऑटिज्म से निकाल सकता है तो वो आप खुद हैं, और हमारी सलाह, हमारा रेगुलर आपको एडवाइस, ट्रेनिंग्स और आपका वर्क अपने बच्चे पे। कोई भी साइकोथेरेपी सेंटर आपके बच्चे में हल्की फुल्की इंप्रूवमेंट तो दे सकता है, निकाल नहीं सकता है ऑटिज्म से। सो हमें ऐसी हिम्मत भी नहीं हारनी है कि ऑटिज्म ठीक ही नहीं हो सकता है। उसके साथ साथ हमें यह भी नहीं करना कि ओवर कॉन्फिडेंट होकर के हम आसपास कहीं छोड़ के आ रहे हैं और ये सोच रहे हैं कोई हमारे बच्चे को ऑटिज्म से निकाल देगा। उस मालिक ने अगर एक बच्चा आपके पास ऐसा दिया है जो आज किसी मानसिक अवस्था के कारण ऑटिज्म में चले गया है, तो हमें समझना है, जैसा कि मैं हमेशा कहता हूं, ऑटिज्म इज अ टेम्पररी फेज इन द लाइफ ऑफ अ चाइल्ड इफ ट्रीटेड टाइमली। सो बहुत जरूरी है थेरेपीज पेरेंट्स के थ्रू बच्चे की जानी, ट्रेनिंग लेकर के। कमांड्स हमें अवॉइड करनी है। Many a times we do a lot of commands for our children and commands are not at all good for your child to come out of autism. When the parents say come to me, कई बार तो ऐसा होता है बहुत बहुत समय से जो पेरेंट्स हैं वो इलाज करवा रहे होते हैं अपने आसपास के सेंटर के ऊपर, और जब वो इलाज करवा रहे हैं अपने आसपास के सेंटर पे, तो वहां क्या होता है, अपने आसपास के सेंटर पे इलाज करवाते हुए वो कुछ कमांड्स दे करके, कुछ चीजें सिखा करके इंप्रूवमेंट दे देते हैं बच्चे को। लेकिन वो इंप्रूवमेंट कैसी है, थोड़ा सा आई कांटेक्ट बढ़ जाएगा, कुछ वर्ड्स बच्चा बोलना शुरू कर देगा, लेकिन अपने आप से एज अ पेरेंट पूछ के देखिए, क्या यही हमारा मकसद है? क्या हमारे बच्चे की थोड़ी सी आई कांटेक्ट इंप्रूव हो जाए, थोड़ा सा कमांड फॉलोइंग बढ़ जाए, आर वी सेटिस्फाइड विद दैट? द आंसर ऑफ मोस्ट ऑफ यू वुड बी नो। सो हमें समझना है कि अगर वाकई में ही हम चाहते हैं कि बच्चा ऑटिज्म से पूरी तरह से बाहर आ जाए, उसका बेस वैसा बनाना पड़ेगा। और उस बेस को बनाते हुए इनिशियली व्हेन वी आर वर्किंग विद यू फॉर फ्यू मंथ्स, our changes, the changes which we intend to bring in your child may be a bit slower to come than the changes of someone who is doing a command based therapy for your child near your home. So definitely command based therapies के साथ initial improvement आप जल्दी देख सकते हैं, but that is not at all our target. So please समझिए, when we are working with your child, on one hand we are using our herbal combinations जिनका मकसद है आपके बच्चे की मानसिक स्थिति को एक बेटर कंसंट्रेशन पे लेकर के आना, एक ऐसी सिचुएशन पर लेकर के आना जहां एक्सेप्टेबिलिटी बढ़े, कंसंट्रेशन बढ़े, पॉजिटिविटी बढ़े, ताकि जब हम आपके थ्रू कुछ चेंजेस लाने की कोशिश कर रहे हैं उसके आसपास के एनवायरनमेंट में, तो वो चेंजेस जल्दी आ पाए। सो दिस वर्ल्ड ऑटिज्म डे, इट बिकम्स वेरी इंपॉर्टेंट फॉर अस दैट we take the right steps for our children. I'm going to your next questions, but all of you who have joined us today, all of you who have been taking treatments from us and currently the children are perfectly all right, all of you who are thinking of taking or starting treatment with us, and all of you who are in the phase of the treatment with us, please do remember, we are not doing any trial on anyone. I did my PhD in role of Ayurvedic herbs and psychological disorders, with autism being one of the major research topics over there, where I used Ayurveda and along with that psychotherapy, ABA to be specifically, and I really got miraculous results. Children came out of it, and that is what motivated me to become a D-Lit scholar. And बहुत ज़रूरी है कि जब हम एक सही जगह आ चुके हैं and we know that we are in right hands, we don't mix up too many things, we keep our beliefs high. Christiana Anthony जी, Hi doctor, Zara's mother here. I hope you remember her. We were in Chandigarh hospital. She now almost fine and we are just on ABA with Dr. Vidhi. Please plan a visit to Johannesburg. There are many families suffering. I really appreciate your words. They are really motivating for me. I wish you all the success. And yes, it's really very good that you are carrying on with Vidhi. Carry on with everything that is guided. And yes, whenever God the Almighty permits, I will definitely visit Johannesburg. So going further ahead, Nehaji, hello sir, my son is 8 years now but not speaking. Eye contact, name, respond, understanding is good but not speaking. Nehaji, at 8 years it becomes very important that if a child is not speaking, we need to take the right steps. Because as the age increases, it takes more and more time for a child to be brought to a situation where he can be out of this phase. And if he is absolutely non-verbal, please share some videos with us, get back to someone from my team. I would also like to update over here that I may be available, maybe it's 90% sure, on the 6th of this or 7th of this month. You can get back to my team for that in Delhi, as I am having a recording on autism on ABP News for some of our patients. So I will try to spare out some time where I can meet some of you over there in Delhi. You can get back to the team. Since the time will be a very limited time over there, it will be a very few of the patients whom I can have one-on-one consultation at Delhi. So any of you who is from Delhi, get back to the team on priority so that that can be hastened up. So Nehaji, please share the details with the team so that they can work immediately and quickly in this regards. Next question is from Mayank ji. Tarun जो है वो coordinator है and आपने बताया है कि मयंक पानी से खेलता है। सर ये जनरली जो है सेंसरी इश्यूज के कारण होता है। जब भी हम बात करते हैं ऑटिस्टिक बच्चों की, ऑटिस्टिक बच्चों के अंदर अक्सर जो है वो सेंसरी इश्यूज हो जाया करते हैं। क्या है ये सेंसरी इश्यूज? अब जब हम सेंसरी इश्यूज की बात करते हैं तो सेंसरी इश्यूज क्या है? बच्चा, पेरेंट हमें आकर के बताएंगे देखो जी जो बच्चा है मेरा वो मिट्टी से खेल रहा है, फिजिटिंग बिहेवियर कर रहा है, ऐसे हैंड हिलाएगा, कई बार बच्चा कानों पे हाथ रख लेगा, बॉडी रॉकिंग मूवमेंट्स करेगा। ऐसी बहुत सी चीजें हैं जो बच्चे करते हैं जब वो ऑटिज्म से जूझ रहे हैं। और खास तौर पे इफ द कमांड बेस्ड थेरेपीज आर डन टू मच फॉर द चिल्ड्रन, इफ टू मच ऑफ कमांड बेस्ड थेरेपीज आर डन फॉर द चाइल्ड, देन दीज बिहेवियर्स इंक्रीज। आज मान लीजिए यू आर एब्सोल्युटली नॉर्मल पर्सन एंड स्टार्टिंग फ्रॉम द डे इन द मॉर्निंग समवन स्टार्ट्स कमांडिंग यू even for the things which you are doing regularly. Now make a tea for me, now bring my chapati, now iron my clothes, now do the room cleaning. After 3, 4, 5 commands, even with those things which you are daily happy to do, you will start saying, hey, why are you telling me that? You will feel irritated. So command always increases irritability, and in a child who is suffering from autism, where the child is already having so many turmoils going on in his mind, with so many sensory issues, any commands are going to increase the sensory concerns of your child. So it becomes very important that today on this World Autism Day, we all take a pledge that we will be taking the right kind of treatment for our child. The right kind of treatment may not be easy for you to get. It may not be near to your home. You may have to travel a long distance, like people who come to us from US, UK, Canada, and all parts of the globe. So you may also have to be one of them. But believe me, if you make it to us through any of these medias, we will make sure that autism becomes a temporary phase in the life of your child. So wishing each and every child suffering from autism a autism-free life out of autism on this World Autism Awareness Day. I, Dr. Navdeep Sharma, will now be saying bye to you for today. Thank you for joining us, and before I leave, the request which I always make, don't forget to like our video, don't forget to share our video. That small support of you can change someone's life. Thank you.
Autism is a temporary phase in the life of a child if treated timely.
Name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
हेलो
आ जाएगा वो।
कलर करो, वेरी गुड पार्थ, कलर करो। नो इस हैंड, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा ना हैंड दीदी का हैंड करो, वेरी गुड, हाउ वेरी गुड। Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma, sir. The sir had told me about him.
World Autism Awareness Day. Risht Pusht Care, Nirogam Private Limited celebrates World Autism Awareness on 2nd April to create and promote awareness about autism. Take the pledge to create a world where every autistic child can reach their full potential by increasing understanding and acceptance.
अप्रैल से हमने ट्रीटमेंट स्टार्ट किया था ग्रैनेट का। हमारे बच्चे में इश्यूज थे हाइपर एक्टिविटी, अटेंशन डेफिशिएंसी एंड स्पीच डिले। जिन भी इश्यूज के साथ हम अप्रैल में यहाँ पे आए थे तो उनमें हमें अब तक 70% अपने बच्चे का जो एक रिजल्ट है वो पॉजिटिव मिला है। ये चीजें कहीं ना कहीं बच्चे के ब्रेन से कनेक्टेड हैं एग्जैक्टली। तो उन सब चीजों पे किस तरीके से काम करना चाहिए, पंचकर्मा कैसे काम करेगा, एबीएस सेशंस कैसे काम करेंगे, उन चीजों को हमने यहाँ पे हर चीज को कनेक्टेड होते हुए देखा है। जिस रिजल्ट या जो भी हमें एक पॉजिटिविटी यहाँ पे मिली है, पर हमने बच्चे के अंदर एक बहुत अच्छी ग्रोथ देखी है।
Very happy parents, and we are very thankful to ND Care. They have supported us so well mannered way. Yeah, in 3 months actually, he started using words. Then he started using combining them. Then after 6 months, he started doing Mama Maggie Didu. Like he started doing like that. That is the first achievement. Yes, I am a happy parent, and today Shaurya is like very descriptive. Still he is learning. He knows everything. In school also people are very happy with him. Teachers are happy. Even earlier I was even not expecting that he'll go to school. I am a happy parent again. Very thankful to ND Care. And Shaurya is very verbal. So I'm very thankful. My words are so limited. What should I say? Like, there are so many things, but I don't have exact word how to thank ND Care and Sharma.
समय से हम लोग आए और बहुत अच्छा उनको रिजल्ट मिल रहा है। बहुत अच्छे से वर्ड बोल लेती हैं, अपने से भी वर्ड बोल लेती हैं, बताना नहीं पड़ता है कि बहुत अच्छे से बोल लेती है। 3-4 वर्ड 5 वर्ड आराम से बोल लेती हैं। योगा चल रहा था तो उसमें एक दोस्त था, उनको योगा करा रही था तो बोले थे कि भैया करो ऐसे 1 2 ND Care से ही हमें विश्वास है कि अनन्या ठीक हो सकती है। अगर कहीं भी इसका ऐसे बच्चों का हमको नहीं लगता है कि अगर ये नहीं होता ND Care तो फिर अनन्या ठीक नहीं हो पाती, मुझे ऐसा लगता है। मेरा
I met Dr. Navdeep. We decided that we'll continue it because the best thing about him was that he was the first one who told me that Agam can be healed. The therapy is only, I don't like that. I don't want to go to robotic improvements. Like he sees a hand and he gives a hand. Yeah. He was getting improvements like that before. Started with Panchkarma. He got settled soon. He was fine. And in the first month only, I saw some improvements. The best thing, he got settled. The staff here is very supportive. He achieved some kind of milestone. He's not saying Mama, Papa. He's not doing anything different. But he's involving. He's involved in me. Overall, if I go through the whole 2 months like journey, like he had good experience. Yeah.
पंचकर्मा सेशन जरूर अटेंड किया 3 days के लिए। तो वो मैं कहना चाहूँगी कि यहाँ पर सेशंस बहुत ही अच्छे होते हैं। यहाँ के स्टाफ बहुत अच्छे हैं जो कंडक्ट कर रहे हैं सेशंस, वो बहुत ही ईमानदारी के साथ बहुत बढ़िया तरीके से कंडक्ट कर रहे हैं। अगर कॉपरेट नहीं करते हैं तो मेक श्योर करते हैं कि अलग अलग टेक्निक सुनाकर, भजन सुना करके या जैसे भी बच्चों को अलाइन करे और वो अपना जो सेशन है वो पूरा करवाए। ये सबसे बेस्ट पार्ट है इस सेंटर का।
बच्चे की थेरेपीज है, सब कुछ बहुत अच्छा, स्टाफ भी बहुत अच्छा। बिल्कुल इसने फर्स्ट डे तो इसने थोड़ा मतलब टेंट्रम वगैरह दिखाए, लेकिन आज इसने बहुत अच्छी तरह से स्मूथली सब कुछ किया। तो मतलब एक उम्मीद हमें जागी कि ये सब कुछ कर ही लेगा। और डॉक्टर साहब से मिलके तो और हमें ज्यादा हो गया कि उन्होंने बोला कि नहीं ठीक हो जाएगा बच्चा, तो हमें तो और ज्यादा उम्मीद आ रही कि भाई अभी तो ठीक होके ही जाना है।
आई थी ना तो अभी बहुत ज्यादा बाइट करता था, तो मुझे ये इसका बाइट करना कम हुआ है। और एक मैम मुझे यहाँ का स्टाफ बहुत अच्छा लगा, रुचि मैम बहुत अच्छे लगे। यहाँ पे अभी की पंचकर्मा थेरेपी चल रही है वो मुझे बहुत अच्छा लगा मैम, ट्रीटमेंट पंचकर्मा। और ADA सेशन मैम बड़ा अच्छा मुझे इसका लगा। हाँ जी, तो मैं तो मैम यही बोलना चाहूंगी जिन पेरेंट्स के बच्चों को जो भी ऑटिज्म है या ADHD है तो यहाँ पे एक बार विजिट जरूर करें।
ट्रीटमेंट चला है तब से ये कुछ बोलने लगी है, जैसे मम्मी रोटी दो, तो ऐसे कुछ चाहिए तो वो भी कुछ बताने लगी है। धीरे धीरे इसमें थोड़ी इम्प्रूवमेंट होते नजर आ रहे हैं करने की, खुद से भी थोड़ी कोशिश करनी। पंचकर्मा में तो जेनिफर जैसे पहली बार जब आई थी तभी से सबसे हो गई थी वो, उसको बहुत अच्छा लगता है पंचकर्मा की जितनी भी है थेरेपिस्ट। और सीखने मिला है किस तरह से मैं थेरेपिस्ट बन के इसको करूँगी, क्योंकि पहले मुझे आइडिया नहीं था।
मुझे एक्सपीरियंस तो बहुत अच्छा आया है, मतलब जो होप्स लेके आए थे वो कंप्लीट हो गए। जो सर ने बोला है मुझे, सर ने गारंटी ली है कि 80% मैं कवर करूंगा। मुझे बहुत अच्छा एक्सपीरियंस मिला, मैं सच बात कह रही हूँ। और स्टाफ भी इतना अच्छा है, मैं माइन्यूट स्क्रीन भी जो स्विंग करता था वो भी बंद हो गया। Thank you, ma'am. Thank you so much.
Another recovery story of autism treatment.
My son Vivan is 4.5 years old and he was diagnosed with autism. Before starting the treatment, we were very worried about Vivan. He had a speech delay, very less understanding ability, and he could not express himself properly. He also had sensory issues and lacked focus. Vivan was not socially active and did not interact much with others.
2022, 27th of November, 11 a.m. Consulted Dr. Navdeep Sharma.
After the consultation, we felt that there was real scope for improvement and decided to start the treatment. At that time, Vivan could not write by himself. He had trouble understanding instructions, answering questions, and interacting socially. As the treatment progressed, we started noticing positive changes in Vivan. Slowly but steadily, there was significant improvement.
Autism is a temporary phase in the life of a child if treated timely.
Another recovery story of autism treatment.
This is the case study of Shaurya Negi, a 6.5 years old child diagnosed with autism. At a very young age, Shaurya shows multiple development challenges. Chief complaints: hyperactivity, lack of attention, sitting tolerance, communication, understanding, sensory concerns. Shaurya detailed medical history was documented and evaluated before initiating treatment. In April 2024, Shaurya parents consulted Dr. Navdeep Sharma and felt confident about the scope of achievement of personalized Ayurvedic treatment approach to us plan using specific herbal formulations to support neurological development, Brain-OR Plus, supporting attention and neurological response. Brain-OR enriched with Mandukparni, Kushmand, Ashwagandha, Amlaki, Jatamansi, Sarpagandha and Ustachodus. Cucurbita oil, supporting nourishment and neurological health. Jatamansi oil, supporting mental calmness and nerves system balance. Mukta Pishti, supporting mental stability and reduce irritation. Before treatment, Shaurya had trouble understanding instructions and did not respond clearly.
सॉरी बोल दो, सॉरी शौर्या कैरी कर दो। शौर्या No humming.
Within 1.5 years of undergoing treatment from Dr. Navdeep Sharma, Shaurya showed significant improvement.
पार्क 4:30 कहाँ जाएंगे?
पार्क।
फिर से बोलो।
4:30 पार्क जाएंगे।
ओके।
5:30 पार्क फिनिश।
Namaskar, Dr. Ruchi this side from NTK Nirogam Private Limited. We are here at Chandigarh branch, Mohali, the Panchkarma Center here, and Lima Negi ji, the mother of Shaurya Negi, is with us. So we will see that how she has experienced the treatment of Shaurya with us in these few months. Yes, whatever you have experienced here in Panchkarma, because I think this time, third time Shaurya is coming, for the Panchkarma and whole in-house processes and all. And as I have seen all progress of Shaurya, it's up to the mark.
It's all because of Handicare. It's all because of Handicare. We are very happy parents, and we are very thankful to Handicare. They have supported us so well-mannered way. So yes, if I talk about history, we came here with less understanding, and yes, there were some behavioral issues, and there were sensories, there were so many things, thoda. But yes, there was more concern about understanding, and verbal nahi tha, he was not verbal. So I was not expecting that I'll get result within 3 or 4 months, but yes, I got it, and within 6 months he started using sentences. Yeah, in 3 months actually he started using words, then he started using combining them, then after 6 months he started doing Mama Maggie Didu. He started doing like that. That is the first achievement. He knew words, he knew alphabets, but he never knew how to connect them. So that was our first achievement, and I realized that yes, things are working. So I got more smarter and I got more workable. Yes, it is very important with medicine to take care of Panchkarma and ABA therapies also. I think if you are under ND care, you have to go according to them, otherwise things will not work. It is my personal experience. Yeah. If we won't go according to the instructions, then things will not work as much as, it will go like, if you are, going through an instruction, then you will get it 100 out of 80. And otherwise it will be like 40, 30, like that only. But yes, I am a happy parent, and today Shaurya is very descriptive. Still he is learning. He knows everything. In school also people are very happy with him, teachers are happy. Even earlier I was even not expecting that he'll go to school. But now he's in our normal school. Yes, there are special teachers also who is taking care of him. But then he is doing good. Up stage aisa aa gaya ki he don't even need any special teacher over there. So yes, I am a happy parent again. Very thankful to ND Care. Shaurya is very verbal. Right now he's not with me, otherwise I have shown him here. And if I talk about, apart from Shaurya therapies and Shaurya, when I came in ND Care, I have seen the growth of ND Care also. When I joined here, things were good, but now it is developing very, very good. It was raw, not exactly raw, but now it has developed very good. I can stay here comfortably. Earlier also I was staying comfortably, but this time it is more good, and it's doing more good and good.
The blessings of the parents like you.
Oh, thank you.
And definitely
no, you are next to God ray for us. ND Care is God ray for us, because we parents are very lonely somewhere. We were like, what to do next. ND Care is a roof where we get everything. So I'm very thankful. My words are so limited. What should I say? Like, there are so many things, but I don't have exact word how to thank NDK and Sharma sir. Sharma sir से मिल नहीं पा रहे हैं बस. From last 6 months we are trying. Yeah, on 26 we have an appointment with some. So hopefully we'll meet some.
Yeah, definitely. And as I have seen, all the Shauras file related to, since the starting in the April 2024, like almost 1.5 years ago, right, the treatment has been started, right? And in this 1.5 years, there is a 90% improvement in hyperactivity, like jumping, climbing, everything has been stopped. Aggression is like now only, around to negligible,
No,
right?
it's like a normal child.
Normal
If
child.
he wants something, we are saying no and no again. So one more thing is very important here. Physically also, Shaurya have grown up very well.
That's
physically also. He started eating things. Fruits तो उसको पहले से ही पसंद थे, but now food में भी उसका interest बहुत है. मतलब physically is growing good.
Good.
Yes,
That's good.
Earlier he was very thin,
Yeah.
lean.
It is actually about the balances of doshas. If there is a balance of each Vata, Pitta and Kapha, in Ayurveda, the things inside, outside, everything going well, actually. So this is actually the basic root, on which the Ayurveda actually works.
Yes.
Yeah. So, and when it combines with the guidance of Dr. Navdeep Sharma sir, then it is up to the sky.
Yes, ma'am. There is one more thing that under this roof we came to know about more and more things about Ayurveda also.
Yeah.
Earlier we are not known about things. So here we came to, the lectures have given us so many things.
Yeah, so speech, if we will talk about, like, it is now descriptive, right? It is now having comprehensive, more
Meaningful.
comprehensive.
It is becoming meaningful.
Yeah.
And descriptive also. Not much, but yes, it is coming out.
He's communicating.
He's communicating very well. Yes.
That's good. That's
If he
really
is going
good.
somewhere, he is saying, yes, I was there and I was doing this and I was doing whole day. He, if I'll ask him what you did whole day, so he'll let you know. I did this.
That's good. That's really great. Thank you so much. Thank you.
Autism is a temporary phase in the life of a child if treated timely.
Another recovery story of autism treatment.
His speech has improved a lot and now he speaks in full sentences. His hyperactivity has decreased significantly. In terms of self-talk, we have achieved about 90% progress.
This is the case study of Aditya Singh, a 4.5-year-old child diagnosed with autism. At a very young age, Aditya Singh showed multiple developmental challenges.
Hi, myself Vidhi. I am a psychologist at NDK Rogam Private Limited. I am working here under the guidance of Dr. Navdeep Sharma sir. Here we will discuss the case study for Aditya Singh. Aditya first consulted at our Chandigarh center,
where a detailed assessment was conducted in consultation with Dr. Navdeep Sharma ji. During the initial consultation, the major concerns reported by the parents were self-talking behavior and limited expressive speech.
Within this, issues like hyperactivity, excessive self-talk, and frequently getting lost in one's own thoughts were very prominent.
Along with that, Aditya Singh showed signs of aggression, lack of eye contact, lack of command follow, and poor attention and concentration, including self-loss behavior and tactile sensory concern. Aditya Singh's detailed medical history was documented and evaluated before initiating treatment.
Good day to all. Myself Dr. Shubham Sharma from NDK Nirogam Private Limited. I have been working over here from last 6 years under the supreme guidance of our senior most doctor, Dr. Navdeep Sharma ji. During the first meeting with patient Aditya, our senior most doctor, Dr. Navdeep Sharma, recommended few medicines for the kid. The name of medicines were Syrup Brainova Plus, 10 ml in the morning, 10 ml in the afternoon, and 15 ml in the evening. And another medicine were Cucurbitur Eye Drops, 8 drops in the morning and 8 drops in the evening. Along with that, Mukta Bishti PV was given. The doses of Mukta Bishti was 0.0625 mg in the morning before meal. And the last medicine was Babuna Oil Drops. The doses were 5 ml, night ODHS.
Followed by 12 ABA session under phycologist Vidhi. The focus of therapy included improving expressive communication, reducing self-talking behaviors. Enhancing attention span and addressing sensory and behavioral concerns. Over a period of 6 months, Aditya's progress was closely monitored through regular intervention sessions and multiple health status follow-up calls with the parents. After 6 months of continuous treatment and therapeutic intervention, Aditya was brought for his second follow-up consultation with Dr. Navdeep Sharma ji in July 2025. Graphical representation and recorded therapy observations showed a reduction in aggression, in which throwing things reduced up to 50%, hair pulling 90% reduced, crying reduced 70%, hitting reduced 30%. In speech, child started sentence making, able to recall past events, improved, 80% expressive communication. Eye contact shifted from 3 to 4, and command following in 5 to from on a rating scale of 5. Self-talking improved 30%, and self-laugh completely improved, and significant improvement observed in tactile sensory concern. Based on clinical observations during the second consultation, Dr. Navdeep Sharma ji reviewed Aditya treatment plan and prescribed Brano R Plus Syrup, Cucurbita Oil, Babuna Drops, Saraswatharishtam with Gold, Vachari Grutham, and Mukta Pishti Premium. Psychotherapeutic intervention continued in parallel with medical management, which continued with 32 ABA sessions over the period of 1 year. In addition, regular health status calls were conducted with parents to monitor day-to-day behavior, emotional changes, sleep patterns, and therapy outcomes. The third and most recent consultation was conducted in January 2026, marking 1 full year since the initiation of treatment. A comprehensive comparative analysis was once again performed to assess Aditya overall development. Significant positive changes were observed in behavior regulation, improved communication skills,
और क्या लिख के आया है? बिफोर आफ्टर लिखाया आदि ने। अच्छा ये बताओ कल रात में कहाँ गए थे?
improved attention span,
4 5 1 2 3 4 5 1 2 3 4 5
and improved social engagement when compared to earlier assessments. Now, the major concern discussed by parents was only the normal conversation of a child. However, expressive speech also develops till that time.
My child's name is Aditya Singh. My name is Varun Pasi. I live in Jabalpur. I have been receiving treatment Dr. Navdeep Sharma for a year now. Just a year ago, my child could only say 2 words, and he had hyperactivity, self-talking, meaning he would get lost in his own world. This was quite frequent and intense. Now it's been a year. His speech has improved a lot now. Now he speaks in full sentences, asks for things he wants, and does all his tasks on his own. His hyperactivity and hyperbolic behavior have reduced significantly. As for self-talking, we have achieved about 90% improvement. There is 10% left, and we are continuing to take the medicine. We got the medicine from here. We were advised to do the Panchkarma sessions. Regular therapy sessions were also conducted, and anyone who needs Ayurvedic treatment can consult Sir here. The treatment here is really good.
Autism is a temporary phase in the life of a child if treated timely.